Hey everybody, just a quick update on some information on hiccups. Like something that we don't always talk about, but I do have customers coming into the store and asking me about, how do I take care of it? And you have, we all know what hiccups do. They can be very annoying. Some people have it consistently. We're talking about months, right? And you can imagine how distraught people are from, because it affects your ears, your throat, your diaphragm, your abdomen, your chest. So they ask me, okay, what can I do, right? And you have all these, all these tricks and things that can help you, but do they really work? Please comment below if you have any, infallible tip on how to take care of hiccups. I'd rather recommend those over medication that can be prescribed. But again, the medications are kept really for people that are nothing has worked, right? And that's become very, very difficult. Some of the tricks that I know, they call from they have some of the tricks that you would see would be things like vagal stimulation. So expiring air forcefully from the back of your throat for 10 seconds as you're sitting down, worth trying. There is some poor studies out there, with regards to even like cutting the we call the phrenic nerve disruption, and that could be used if other things fail, but I'm not too clear on how effective that really is. One of the things that they recommend in terms of pharmacology or medicine standpoint, because I am a pharmacist, so this is really where I wanted to talk about. They talk about chlorpromazine, which is an antihistamine type, anticholinergic, and that's been a drug of choice for persistent hiccups. Haloperidol have been effective, and also metoclopramide. But the studies were small, but it's still one of the choices that are out there. And you still want to look, you want to be mindful of some of the side effects that they can cause from dry mouth, from tiredness. Those are the things that you want to look out for because it causes drowsiness. Other things that you can use, so those are what we call the dopamine antagonists, and the other things that you may want to consider will be muscle relaxants, because it helps relax the diaphragm muscle, and that you can use baclofen, and they would work in about, let's say, 50% of cases, so it's still worth trying. And but they recommend not stopping it immediately or discontinuing suddenly if it does work. And what you typically would see, if a drug is effective, it would work fairly quickly, okay, so even within a few hours. So but if they don't work, there's no need to continue for more than 3 days. So if you're not seeing that happening, then don't use them anymore. And also recommending that you should avoid benzos, so anything like Valium or Lorazepam, that kind of stuff. Lorazepam, they actually worsen hiccups, and that's what we've been seeing on that. So that's in a little bit of a quick recap on hiccups, pharmacologically, what we can do for that. There have been other drugs that have been useful, from carbamazepine, gabapentin, nifedipine, amantadine, amitriptyline. So there's a list of things, but you would have to take them one at a time and see what would work, and then move from there. So anyways, I hope the information was helpful today. Love it if you can comment if you have any tricks and tips on some non-pharmacological, here I can't even pronounce that, uses of how do you basically help us, like if this works, right? Scaring you out of a hiccup. Not sure how effective that's been for you in the past, or drinking water, holding your breath, that kind of stuff. But let me know. I'd love to learn as well. And I hope you have a great day. Thanks for tuning in. I'll talk to you soon. Bye.